that is the antidote to the shame, the stigma, and the silence. It is education so that we hear about it early on in our lives, and therefore it's not shocking. My kids know about miscarriage.
Hello, and welcome back to another episode of the Birth Lounge podcast. You guys, have you downloaded my absolutely 100% free class on how to avoid a C-section? As I was going through my Instagram DMs and our emails this last week, I had so many questions from women who were scared to have a C-section. They really wanted to have a vaginal birth. They desired to be the ones that were in control of the decisions made. But they shared stories like, this week at my OB appointment, I was told that I wasn't allowed to birth in any position except on my back. Or this week, my OBGYN shared with me that I actually couldn't decline Pitocin if my water was broken. Or this one was actually the worst one, and she shared that her midwife, yes, a midwife, told her that she would not, under any circumstance, continue to give her care if she decided to go past 5 days past her due date. Can you even imagine that? Choosing a midwife because as a low-risk woman, you know that midwifery care is better. You know it gives better outcomes, and you typically receive more individualized care, only to reach 39 weeks and be told that regardless, you had to have your baby in 12 days or your midwife would drop care. Guys, these stories are absolutely unreal. Not unbelievable, but unreal that there are care providers out there who are giving out this type of abusive and coercive care. I want to teach you how you can do things differently. I want to teach you how you can actually be informed and empowered and confident in navigating these conversations and being able to say, thank you so much for sharing your specific preferences. I'd love to see this written out if it is a hospital policy. And I'd love to talk about what that transition of care would look like if and when you decide to drop me as a patient. For that person who needs to navigate the conversation about pushing on their back, I want you to feel confident in saying, thanks for sharing your preference. If you're not comfortable birthing my baby in other positions other than on my back, I'd love to meet providers who are. Maybe you could set me up with some of your colleagues. This is exactly what I teach you in my free class. It's exactly the steps that I have taught thousands of women before you to avoid a C-section. And you want to know something crazy? Last year, out of 365 days of attending birth, we only had 3 unplanned C-sections. 1, 2, 3. 3 unplanned C-sections out of 365 days of supporting moms. Yeah, that's right. This works. When I say that I'm going to give you the tips to exactly how you can avoid a C-section, I really do mean it. You know I'm a woman of my word. So download my free class. You can go to thebirthlounge.com/C-section. It's completely free. Once you put in your name and your email, it will land right in your inbox and you can watch an immediate replay. At the end of that class, I also dish out my top tips to help you avoid avoid tearing, because not only am I going to help you avoid a C-section, I'm going to help you keep your hoo-ha intact. This class has literally been downloaded thousands and thousands and thousands and thousands of times all over the world, and it has proven results. So visit thebirthlounge.com/C-section and get your hands on my free class today, all about how you can avoid a C-section and reduce your risk of tearing in labor. All right, let's shift to today's episode, which is a little bit of a heavier one. Taboo even. There's some stigma around it. Big feelings, big emotions like shame, guilt, blame, silencing. We're talking about miscarriage. Today, I'm joined by Jessica Zucker, who is a LA-based psychologist specializing in reproductive health, and she's the author of award-winning book, I Had a Miscarriage, a memoir, a movement. Jessica is also the creator of the viral #IHadAMiscarriage campaign, and her writing has appeared in the New York Times, the Washington Post, New York Magazine, Vogue, and the Harvard Business Review. She also has a second book titled Normalize It, Upending the Silence, Stigma, and Shame That Shapes Women's Lives, which is out now and available everywhere books are sold. Today, our conversation is going to revolve around the feelings and emotions that happen with pregnancy loss. How can you support someone as a friend or a family member when they experience loss? Where do you go when you experience loss? What kind of communities are available? And what's normal? We are really out here normalizing a really common experience that 1 in 4, and that's just what's reported, women experience on their fertility journey. We're going to dive into what role our medical system plays in either reinforcing or dismantling that emotional isolation, and how damaging the phrase "at least" can be, or sharing something stupid like everything happens for a reason. While I wish we lived in a world that did not have any sort of prenatal or pregnancy loss, unfortunately, that's not our reality. So I want to take one step closer to normalizing it, getting the word out that you're not alone, and empower you to find the resources that will bring you comfort, even if it's just a little, should you encounter this excruciating experience. If you're out there listening and you've experienced any sort of loss, I want you to know that I'm sending you the biggest, deepest, warmest hugs. I see you, I'm here with you, and you're safe in this community. Also, please know, as always, if this episode is too much for you to listen, or you're just not in a space to receive this information, please don't hesitate to hit pause. There's no obligation to listen to these episodes. You can completely skip it, or you can come back later, and Jessica and I will be waiting for you with open arms. XO. Hee hee. All right, you guys, without further ado, Dr. Zucker, welcome to the show.
Thank you so much for having me.
Thank you for joining me. I know this is a topic that often comes with a lot of big feelings, and I think that so many people shy away from this conversation, even though it is such a shared and common experience among women, which leaves us feeling shame and guilt, and as if we can't talk about our own experience, which obviously leads to isolation. And you cover all of this in your book really beautifully. And so I'm really excited for this conversation. I know that it is a sensitive topic and a topic that listeners, you may need to hit pause on. And I assure you, please do listen when you are in a space to take in this information and receive this type of information. And Dr. Jessica and I will be here whenever you are ready to hit that play button back again. Okay, a good place for you to start, I think, is just letting us know, why did you write your book? What made you want to hold this space for other women?
Oh, wow. Well, We could be here all day together in answer to this wonderful question. So, again, thank you so much for having me and for wanting to talk openly about a subject that so many people are familiar with, but don't feel necessarily comfortable talking about. So, where to begin? I am a psychologist. I specialize in women's reproductive and maternal mental health and have done so for over 15 years at this point. And so I specialized in this arena long before, I don't, maybe 5, 10 years before undergoing a second trimester miscarriage firsthand in the context of my home. So, in the aftermath of that, I just could not stay silent, not just personally, but I decided that it was time. I decided that I wanted to somehow try to make a dent in the cultural conversation or lack thereof when it came to miscarriage, pregnancy loss, infant loss, and life after. So that resulted in my first book project. I started something called the I Had a Miscarriage campaign in 2014 with my first New York Times piece. And that sort of went viral and created this whole thing that I was not prepared for, honestly. I just hadn't anticipated that it would take fire the way that it did. It was so humbling, it was so heartening, and it was so enlivening because it connected me with women around the world who knew this pain too well. So, my first book, I Had a Miscarriage, a Memoir movement, came out in 2021. And then I want to say within 6 months of it coming into the world, I was approached by a mental health publisher who wanted me to write another book. And I had recently been diagnosed with breast cancer. And this approach, like this coming toward me and wanting me to do something, even knowing that I was going through this life threatening situation, felt like a lifeline. Like it felt like something, it was such an opportunity. It felt like something I could not say no to. And essentially, this next book that came out in April, it's called Normalize It, Upending the Silent Stigma and Shame That Shape Women's Lives. It's an expansion. Now, in no way does somebody have to read the first book to understand the second book. But the second book is me taking my lens and my expertise further. So this book is an urging for people to use their voices, to engage in the act of storytelling, whereas not to feel a sense of shame. Mm. But in this one, I'm taking on everything from girlhood through menopause and then some, all from a psychological perspective. None of this is medical, of course. But what I'm trying to do in each chapter is illuminate through fictitious patients the various ways that people struggle with menstruation, with body image, with eating disorders, friendship struggles, relationship, romantic, sexual issues, a whole gamut. It includes, of course, pregnancy loss. It includes fertility struggles, terminating for medical reasons, opting out of motherhood altogether. So I try to embrace and include all the topics related to women's lives.
I personally love how you are bringing what I think is often labeled as taboo topics, but they're not taboo. They are to be human. They are very normal experience, not something that anyone ever expects to experience, but one that when you do experience it, if we only realized how many other people around us, either directly in our community or worldwide, were experiencing these things alongside us, it would make us feel so much more seen and supported. You've said that silence and stigma and shame are this cultural scaffolding of pregnancy loss. Why do you think that so many women internalize those big feelings like guilt and shame and blame themselves for things like miscarriage when we know that miscarriages are in no way our fault.
Ah, thank you for saying that. Yay. It's interesting because I feel like some of the women I've interacted with since this book came out actually still hold these feelings that somehow it might be their fault. And so you can be incredibly educated. You can be a medical doctor. You can be a nurse. You can work in, you can be a doula. You can, and, or a psychologist, whatever it is, and still somehow arrive at these feelings. Still somehow have tucked in the back of your mind that maybe I should have done something differently. Maybe I wanted this too much. Maybe I actually didn't want this enough. So there's a lot of interesting and befuddling magical thinking that can go into the experience of miscarriage, pregnancy loss, and infant loss. And when you said, why are people blaming themselves? I thought automatically it's because we are taught from the get go that if we try hard enough in our lives for something, we can attain it. And so for the most part, that is true, right? If we study hard enough, we get into that school. If we apply enough, we get the job we want. If we go after that other accolade in a smart way, we might be able to attain it. Reproduction falls outside of that realm, right? So we can do all the quote unquote right things and eat the things and stand on our head or do the yoga and the acupuncture and whatever people are telling us we should be doing to support our bodies and our health and the reproductive outcomes we're looking for, and still not get them. And so I do think the self blame oftentimes comes from that sort of societal messaging that we've grown up with all along. And so then we're like, wait, I must have done something wrong here if I can't seem to achieve what it is that I want. Also, though, and this is more psychological and interesting, I think, when people blame themselves, embedded in that blame is this kind of notion, not consciously, if I did something wrong, then going forward, I can do something differently, which will result in an outcome I'm happier with. And again, it's not altogether true, if true at all, but I think that's the idea, or that's the sort of, again, unconscious pattern of thinking. So if I did something to deserve this, or if I did something I shouldn't have done, next time I'm staying far away from that. But then what? If they stay far away from that and they do something else and they still don't get pregnant, or they do have another miscarriage, then what? I think that it is so difficult for us as humans to embrace the idea that we are fallible.
Yeah.
And the science is there that, what is it, 80% of miscarriages are a result of chromosomal abnormalities. And then there's all these genetic issues and other things that can be going on in the body. How is that a fault of our own? So I think sometimes getting caught, though, in the grief or even self hate or self blame or admonishing oneself can be a defense against dipping into the feelings, really being in the grief, if that's what it is, or the outrage, or the anger, or the rage, or the relief, whatever the feeling is. When we get so busy trying to figure it out and trying to make it different the next time, we oftentimes just don't allow ourselves to actually swim in the experience, in the grief, in the mourning.
Yeah, that's very cultural, right? We, from even a very early age, and as we go on, as the years pass, we continue to be separated from ourself, right? We've got technology, we've got society messaging, we've got all sorts of programming coming at us every day. We are busier now than ever before. I also think we live in a really fix it culture, right? So, what you were saying, there's got to be something I can do to fix this. Alongside that, I find that the women that I've supported who have experienced loss at many and multiple, a variety of stages in their reproductive health, whether that be loss of their fertility and they've never experienced a pregnancy, or it is an early miscarriage before they even announced to people, or it was a late loss after they had announced and bonded with their baby and even prepared their home and their lifestyle for this baby, are the ideas of the shoulds. I should do this, or I shouldn't be thinking these thoughts, or I shouldn't be responding or reacting this way, or is something wrong with me because I am responding or reacting this way? For listeners out there who have either been in those shoes or are listening now in that current place, what do you have to say to them?
I would say to them that the shoulds can be a very slippery slope. And I think that can siphon other feelings. And also it slides us into a potential shame spiral. And this idea of shame, what is shame? Shame at the core, I think, is I'm bad. It's not just I feel bad today, therefore X, Y, or Z. No, it's really like a feeling that something I'm incredibly ashamed of, something I need to hide, and that I am bad as a result of it. And so, my concern with this shoulding on ourselves all the time and having these kind of arbitrary rules for ourselves, we then don't have the opportunity to be more flexible or more creative in our thinking or to be more graceful with ourselves and compassionate, because that's the missing ingredient. When I sit with patients who are dealing with a puddle of shame and they're convinced I'm a bad person because of X, Y, or Z. When it's related to pregnancy loss, it's like, I did not protect my baby, for example. And when I say, along with, what if you did everything exactly as you needed to? That's when the tears fall. There's so much relief when we get mirrored back to us or reflected back to us a sense of feeling understood, feeling validated, but also sometimes being questioned for this kind of nonsensical space that we can put ourselves in that is so self-injurious sometimes or so painful. We almost just need somebody to come and puncture that or disrupt this way of thinking, because when we're in our heads about self-blame, it can be very, for lack of a better word, toxic and cruel.
So, what's the answer to breaking out of this shame and this guilt? Is it simply to just normalize it and to speak about it and when it happens to you so that for other women and for yourself, you don't feel so isolated and alone?
It is a great question, and it's complex, and it's also very simple in a way. So in Normalize It, I outline the various ways. I try to give a slew of examples of pathways for people to speak their truths. So it doesn't have to be a TED Talk. It doesn't have to be an Instagram post that goes viral. It does not need to be getting on your rooftop with a bullhorn and sharing with the entire neighborhood or community. It doesn't. We can take care of ourselves through pulling out a piece of paper and writing it down. Right now, I'm feeling blah, 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 horrible about myself because I had a miscarriage, and I'm convinced that what I ate, or the sex I had, or the caffeine I drank, or the sip of wine I had created this outcome. I'm convinced that it's all me. I'm bad. I did something wrong. Okay, what happens then? Now, of course, writing it down does not alleviate the feelings. So we're not trying to get people to not have their feelings. But what we're trying to do is move them through the body so they're not stuck in our heads. And so they're not meandering around in this like deafening silence that exists within ourselves if we are adhering to this cultural silence that's required and yet is it? We get to decide for ourselves how long we live in this society that says, hush about this topic and that topic and this topic and that. It's your pain. So I feel the most sort of advantageous way to honor that is through getting close to it, because we all know it doesn't go away by ignoring it. So, yes, it can be through meeting with a therapist. It can be through writing your own book about it. It can be through talking to a neighbor, a best friend, your partner, a family member. But it can also be writing about it and burning it. It's like it doesn't have to be a public display. And yes, I guess if it's more public, then perhaps we help other people by modeling this, and maybe then people feel inspired to do the same. But it's not necessarily incumbent upon us to inspire everybody to be outspoken about the challenges in our lives. Most importantly, we normalize it through acknowledging it. We normalize talking about hard things through putting them somewhere rather than sticking them only in our minds and then feeling worse. So through exchange, even like what we're doing right now, we both kind of change in some way. The vulnerability can make us feel so much more connected, whether it's one-on-one or with community at large.
Yeah. Okay, so for someone who has never experienced the loss,
Yes.
how do you explain the emotional aftermath of a loss? And what should that person know about supporting a friend who's experiencing that?
Yeah, that's a really important one as well. Here's the thing. I feel like because now, I've been through a 16-week loss. I've been through breast cancer. And so I see how badly our loved ones want to support us. I also see that when we haven't walked in the shoes of somebody else, sometimes it's really hard to know what to do, despite our amazing intentions. So I think we have to begin with grace. And I think it's very tempting for people to say, I just don't know what to say, so I said nothing at all. Or I didn't want to make her think about it in case she wasn't, and so I didn't bring it up. These become easy excuses in a way to bypass dealing with the uncomfortability that may arise in this conversation. Okay, so here's what not to say, because that's an easier place to start. And unfortunately, these are the platitudes that so often just swirl through our culture amidst grief. So, any phrase that begins with at least, it's a no go. At least you know you can get pregnant. At least you're young. At least you have another child. At least you have a thriving career. Nah, because when we say, and the most frequent one I think is, at least you can get pregnant, you're like assuming the role of a medical doctor. And even medical doctors sometimes say that. And they mean it from a different perspective. I think for them, it's important information. We know that your body can get pregnant. But when lay people say it, I think what they think they're saying or what they're hoping to relay, I think, to the griever is, you can get pregnant, so you can get pregnant again. So just try again. And it's that they wanted that pregnancy. And now there's fear in a place where maybe there hadn't been fear prior. I think staying far away from at least sentences are a must. I also think that getting into these sort of silver linings, people seem to say things like, God has a plan, everything happens for a reason, God doesn't give you more than you can handle. Unless you know the person has similar religious or spiritual beliefs, I would steer clear of these as well. To say to somebody who's just lost an infant that God doesn't give you more than you can handle is outrageous. And again, just, I think, pouring salt in a wound. Okay. Here's the good news. The good news is that all we need to do is relay genuine care. And it goes something like this: I'm here for you. I want to hear what you're going through if and when you're ready. I'm sending you a care package. And I do think that it can be very helpful for there to be consistency in the follow up of a loss, depending on the person's experience. So we also don't want to assume how somebody feels in the aftermath of loss. Some people feel like it wasn't that big of a deal, and others feel like it was the most traumatic experience of their lives and everything in between. So we want to get a sense of where are you at? And if it's somebody who's saying, I'm in so much pain, I'm totally afraid that this is going to keep happening. I want to be a mother so badly, and I feel like it's out of reach now. And if you know they're struggling, follow up. Again, it doesn't take a lot of time or energy to do. How are you? I'm here. I'm thinking about you.
That can be really tough when you feel so uncomfortable and if it's shoes that you've never been in. And I totally relate to the sentiment of if it's not on their mind, I really don't want to be the one that brings it up. But I think the truth is that once you experience something like that, not a minute goes by in your day that it's not on your mind.
I know, to be honest, like I think about this a lot vis-a-vis my breast cancer diagnosis, which was back in 2021. And so I had surgeries all through 2022. So it's been a while, but for me, it still, of course, lives in my body. The scars are here for me to see every single day. So I'm reminded. And I am struck by the fact that certain people don't every once in a while ask me, how have you been about it? How are you feeling about all this? Where does this experience live in your body now or in your psyche now? Or how does the medication that you have to be on affect you? And does it remind you of your diagnosis on a daily basis or something like that? I think it's fascinating that we want so badly, and again, it comes from a good place, but we want so badly for our loved ones to be okay, but we can't fix them. And we also can't ignore them away. So by not talking about it, we don't lessen the pain and we can't erase the experience altogether. And so I do believe that saying something, even if you put your foot in your mouth and you later say to the person, oh, that's not how I meant to say it, or I'm so sorry if I was like off on that. All I wanted to do was basically tell you that I'm thinking about you and I love you and I care about you. It's so much better than ignoring the topic altogether. And so we don't have to have lived through everything to be able to offer support or to just lean in. And it doesn't require lots of research or I'm going to try to feel what she felt. We can't walk around doing that all day long. It's too intense and it requires too much maybe, but avoiding it does not strengthen a bond or propel the relationship forward in a positive way.
Yeah. Yeah, I can totally relate to that. And I can see how You would just be further putting into that isolation by trying to ignore it when really they just want you to acknowledge it. Even if you don't know how to acknowledge it in the right way, I tend to, listeners know this, but I tend to just be a really upfront, blunt person. So I may say something like, I don't know the best way to support you, but I can promise you I'm here with you on this walk. And if anything that you need comes up, please don't hesitate to reach out. I'm going to continue to check in, but you shouldn't feel any obligation to respond to me or to join in anything that I invite you to. I just want you to know that I haven't forgotten about you and I'm still here whenever you're ready to jump back into things. Whenever that is, how slowly or fast that may be for you, I'm here. And I think,
Like you should publish that as like a guide for
aw,
being a support for grievers. That's perfectly put. And but it's fascinating. That's so hard for people to kind of embrace. I don't know. But yes, that exactly. Beautiful.
yeah, that is hard. It is really hard to not know what to say. And I think that's a lot of the discomfort is that you do want so desperately to connect with them, and a piece of you do wants to fix it. That's impossible. So,
Yes,
what's the next best thing? And I think for a lot of people, if you don't know the right answer, it's easier to do nothing instead. So,
exactly.
that's really unfortunate.
And I think collectively, though, if we just dare ourselves to be a little uncomfortable because we know what it's like to have some version of pain in our lives, and we know how we felt when people didn't lean in,
Hmm.
then we can help those going through future losses or future grief.
Yeah, I think that's where my drive for like genuine support and connection comes from is I've had places in my life, not a loss, but I've had places in my life where I felt lonely and I wish that the people in my life had reached out to me and had supported me in a better way. And so I dig deep and say, what would I have wanted to hear in
Yes,
those times in life? And then I tailor it to whatever my friend or family member is experiencing at that time to just let them know that hey, I'm not perfect and I can't necessarily understand what you're going through because I have never experienced it, but I do sympathize with you and I'm able to be empathetic to your situation. And while I may not get it right every time, I can promise you won't be alone. And I think that is so powerful because in
it
a
is.
time when you feel super alone, sometimes it's just that one person that reaches out where you're like, all right, that's all I needed today.
It's a game changer.
Yeah. Okay, so
Yes,
now I have an uncomfortable question for you. As
sure.
someone who had been in this career and you had a lot of familiarity with loss and supporting people in this walk, how did that inform your experience when you experienced your own loss?
Yeah. That's interesting. So wait, what's uncomfortable about that? You mean did I feel able to navigate that line once I came back after my loss? Is that what you mean?
Yeah, no, I think it's just uncomfortable to ask someone so directly about their loss. This is,
Oh,
again, it's very taboo to say, tell me about your pregnancy loss. It's something that you typically don't ask so directly, but
right.
I'm a doula who has 10 years of experience being a doula, and I'm now pregnant with my first child. So I think a lot of people are super interested in how that has informed my
Mhm.
pregnancy and will inform my birth choices. And I'm interested to hear how that informed your experience after you had so much experience with that walk of life, but hadn't necessarily experienced it yourself until
I
you
see.
did.
Yeah, no, that's relevant and poignant, really. I know. It's like you couldn't write something like this, even though you could. This happens all the time, but it was like, how is it that I specialized in this for all these years? Because even prior to getting my PhD, I have a background in public health. So I have a master's in public health and worked internationally in women's rights and women's reproductive health. And so it just felt, wait, I truly have dedicated my entire life to this, not just loss though, but all of it. And then I have the most horrific experience that I had heard to date. Now, of course, I've heard so many other stories since because I've been specializing it for so much longer since my loss was back in 2012. But it was, it really threw me back. The amount of trauma that I went through in that experience was not something that I could have ever prepared for. No book could have prepared me. No amount of sitting with people talking about it, no conferences, because my loss took place in the context of my home. It's unfathomable. But and then I had to cut the umbilical cord myself, and then I hemorrhaged, and then when we got to my doctor's office, I had to undergo an unmedicated DNC. So it was like the trauma just kept on going, the physical trauma, the psychological pain. It was just unending and excruciating. And to the degree to which like I was out of body at some point, because how can you not be, right? You're like looking in on your life thinking like, am I in a documentary? What is going on here? So because I work for myself, there was nobody to turn to. There's no HR. There are no I have colleagues in my field, but there was nobody in my office space that I could say, what in the world do I do now? And so I had to figure all of that out myself while I was also grieving and bleeding and hormonally charged and all of this. I had to decide, what do I say to my patients? When? How do I return to work? How much do I tell them? It was wild. So, in answer to your question, I would say this. I think having gone through this has informed my sense of obviously the enormity of the pain, the profundity, and has made me, hopefully, a better psychologist. Now, do I wish I hadn't gone through it? Of course. But do I think that I have put it to important use? I feel like I wanted, and again, not everybody needs to do this or feel compelled to do anything at all, but I really felt like it was important to me to try to do something in society because of how much information I had. I had known about the statistics. I knew how women felt. I sat with them and heard about it. And now I'm in their shoes. And I'm feeling so many of the same things and different things as well. I didn't blame myself, for example, but I did feel lonely and I felt like I was amazed in not a good way by the platitudes that came my way. I was just astounded, you know. And for me, processing that through writing was my vehicle for healing, for changing the world in some way, hopefully. And, for me, writing these books just kind of gets me there. And so, but it's not, I think, that we have to have walked in the shoes of all of our clients or our patients in order to understand or validate or be there for them in a deep way. But I do think that the fact that I have helps a lot of the people that sit with me. The people who were seeing me at the time of my loss, some of them got scared, and understandably so. And so I had some changes in my practice at that time. But people who have since found me or have come across my first book, my second book, other writings, I think feel heartened by the fact that I have been there too.
Yeah, there is something about knowing that your provider can understand your point of view. I feel very strongly about not seeing male OBGYNs. It's not to say that I would never be seen by a male OBGYN or I wouldn't let a male OBGYN practice on me if I truly needed it, but I have a preference for female OBGYNs. I
Yeah.
have a preference to have mental health counselors who own their own business and are married and maybe even struggle with anxiety themselves because it makes me feel as if they understand my perspective and they can truly connect with me on a different level rather than a mental health counselor who maybe doesn't own their own business or has never struggled with anxiety or is single by choice and they aren't in a relationship. I like to know that the people who are supporting me have walked a similar path as me, and it just makes me feel safer. I am in no way trying to diminish your loss in any way, but I can definitely understand how it serves a purpose to be a deeper connection point between you and your clients.
I agree. I totally agree. And I think that's why I wrote my first book, because it was
Mm.
just like, I need to bring all of my learnings and all of my sort of inner struggles with what I went through and with what I've seen in the world to the people, because there aren't that many great books on the topic that make people feel truly seen, truly understood, and validated in the aftermath of pregnancy or infant loss.
Yeah. Okay, I have a question about this experience of loss and how we think culturally we might be able to shift it. And I'm particularly interested if you think some earlier education, it was prompted by you talking about your book, Normalize It. And you actually go back to puberty, getting your period, and that younger early education. I'm wondering if we started to educate young girls alongside their
Yeah.
menstruation and their fertility and their overall health, if we also began to normalize, destigmatize, educate young girls about loss at that age, do you think, and I understand this is all hypothetical and like it's a hypothesized answer, but do you think we might be able to avoid some of the stigma, shame, guilt, silencing that happens later in life because it has been, well, normalized?
I think this is the best question ever. Yes, 1000%. I wrote a piece many years ago about the fact that sex education singularly focuses on how not to get pregnant and how not to get an STD or an STI. But where is even a sentence about fertility struggles or pregnancy loss? Now, I know, of course, like we have to be incredibly sensitive about developmentally appropriate language, and we don't want to scare kids into thinking that babies die necessarily, or like that they might not get pregnant themselves. So it has to be very well thought out. But that is the antidote to the shame, the stigma, and the silence. It is education so that we hear about it early on in our lives, and therefore it's not shocking. My kids know about miscarriage. I don't talk about it as much as I used to. They knew about, I waited to tell my son about my loss until he was a little bit older, but they both know that had I not had my loss, my healthy daughter, who's 11 and a half, wouldn't be here. And that's complex. That's like deeply almost philosophical. That brings about really interesting questions and experiences for the family to have together, talking openly about the fact that this happens. And it's not a fault of ours, but that this is a possible outcome of reproduction. And so, if it doesn't necessarily mean that it will soften the pain, but then it won't be as shocking, maybe. And then it won't be something that you feel like, oh, I shouldn't talk about this because women are supposed to be, quote unquote, born to be mothers or whatever. And so I think it would give us more room and more space if we normalized it from the jump.
I agree. And I really applaud you for having these hard conversations, even when they feel uncomfortable with your children. I think that's something that a lot of parents shy away from, right? And they think things like, how could my child conceptualize this? Or maybe it's better just to not to mention this at all. Or I'm afraid that if I tell them about it, they'll have a bunch of questions. And I just want to say thank you for modeling for all of us how you can navigate that as a parent, because just like it can be very uncomfortable as a friend to support someone in that, it can be very uncomfortable to facilitate these conversations with your children and even adult family members. And I just want to say thank you. I know that's really hard for a lot of people and we shy away from those conversations, but I personally think they are really crucial to have. Okay, my last question, and this is
Thank,
because,
thank
yeah, absolutely. We have a lot of healthcare providers that listen to the show, which I'm very grateful for. And I love when you guys show up because I just love to share the space with you guys. What role do you think our medical system has in either reinforcing or dismantling the emotional isolation that follows a miscarriage when someone experiences a loss?
Ooh, that's a tricky one. I'd love to be in conversation with an OBGYN about that. Here's the thing. Even when it came to navigating breast cancer, there were times where I felt disappointed, let's say, by my oncologist not talking about the emotional sequelae of the experience of breast cancer. Like, what is the trajectory typically in terms of you're in survival mode at first, you go to all the appointments, you do all the things, but then when the emotions or when the kind of psychological impact comes to the fore, it's usually after you've made it through all of this stuff. And then what are we supposed to do? But what I've really thought long and hard about is they are trained in what they are trained in. As much as I wish that every OB and every midwife and every doula and every oncologist and every breast surgeon, whatever, would also offer these beautiful words or this compassionate care or say things in a certain way that makes us feel whole and seen and deeply cared for, I'm not sure that it's a fair expectation, right? I think, of course, there are individuals who have, let's say, an OB has been through her own miscarriage and can draw upon that. And so that sort of maybe helps her understand her patients and she can relay that or not. Maybe they don't want to. I think what can be difficult, and I hear this a lot in my practice, is that a lot of my patients end up feeling like it is such a medicalized experience and they feel rushed through the process. Oh, it's a miscarriage, try again. And so I don't know if I'm answering your question. I think it's tricky. I do wish that someone would write it, and it's not going to be me, but there should be almost like a required text or workbook or something for all of these fields so that they can truly understand, at the very least, what their patients are going through from an emotional perspective.
Yeah, I'm hopeful that we will eventually get there because it's just simple, trauma-informed, patient-centered care. And I do think that our healthcare system is moving in that direction. And hopefully, soon, one day in both of our lifetimes, it will be the norm and not the exception. Oh, Dr. Zucker, this has been amazing. You're such a great guest, and I have really appreciated you sharing your story. And I am really eager to read your book, and I look forward to sharing it with all of our listeners as well. Where can people connect with you? Where can they learn from you? Where can they work with you? And where can they grab copies of your books?
Okay, so I can be reached through my website at drjessicazucker.com. On Instagram, I'm at I Had a Miscarriage, and my books are available everywhere books are sold.
Oh my gosh, I love that. Thank you so much for
Thank
joining us.
you. Thank you so much for having me and for providing this beautiful conversation.
Absolutely. Listeners, you know that one thing I'm not afraid to do is to go there on taboo topics and topics that feel too big and topics that, quite frankly, nobody else wants to wade in. I'm here for those conversations. And like I said, I may not know always the best way to navigate it, but what I can promise you is that I'll show up real and authentic and raw for you. And I'm going to provide a safe space for you to always feel what you need to feel, pause when you need to pause, and I will be here when you're ready to come back. I love each and every one of you so much. And if you're out there listening and you have experienced a loss, I am so sorry for you. I'm sending you so many hugs, and I want you to know this is a space on the internet that you are totally safe to be and feel and do whatever you need to do to get on your healing journey. I'll see you guys in the next episode. Be sure to follow Dr. Jessica on social media. You can find me at Tranquility by Hee and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm Hee, and this is the Birth Lounge Podcast.